Are we live? I think we are live. Let's see. Okay, we are. Good afternoon. This is Amanda Marino. I'm here with our clinical psychologist, clinical advisor, Dr. Jeffrey Huttman, also a longtime colleague, mentor, and friend. Good afternoon, Dr. Huttman.
Hi, good afternoon. Thanks for inviting me to join you today.
Yeah, no, I love any time that the world gets to experience some of your magic, because you tend to be a behind the scenes, professional and do such great work at what you do. But you're an amazing speaker, and there's so much that you add to the field of mental health and substance use disorder. So I'm grateful to have you here today.
Thank you. Appreciate that.
So I want to start by, the topic today is the role of a clinical psychologist in the intervention process. If you want to start off maybe by sharing a little bit of who you are, your background, before we kind of get into that. What's your education and what have you done in your career?
Okay, yeah, sure. So I'm a licensed psychologist in Florida. I've been practicing for almost 30 years. I started doing this when I was working in the field of addiction and behavioral health when I was in college. My first job in the field was working as a behavioral health tech in a partial hospitalization program for children and adolescents. And I liked it, felt like I was, able to make a good connection, and just kept growing from there. So I put myself through school working in the field, and I eventually obtained my bachelor's in psychology, 2 master's degrees in psychology, and my doctorate in clinical psychology.
What are the 2 different ones that were masters?
So I have a master's in general psychology and a master's in clinical psychology.
Okay.
So a lot of overlap, but the first one gave me more of a psychodynamic edge, and and helped me in that way. And the second one was much more practical, which is what I wanted to do with my career, was not necessarily teach, but to be more hands-on, more of a practitioner. So it was that type of model. And I was lucky because I was putting myself through school by working in the field, and got a lot of different opportunities and experiences at an early age, and then went into administration. So I've been balanced in my career, being able to maintain a private practice and work hands-on, while also I served as a clinical director, a chief clinical officer. I was a CEO. I'm sorry? Owner, CEO for many years. I'm a CEO now of a telehealth company that we started before the pandemic. I'm in private practice, and then I do supervision and consultation with you guys at Next Level.
Yeah, we love it. We get to do every week. We meet with Dr. Huttman and go through all of our clients, and get his clinical expertise on things that may not be seen, and help with the overall picture. And there's not one week that goes by that I don't leave with something that can add to our care with our team and with our clients. Every week we leave with something. So what brought you into this field?
Good question. So as I said, I got my feet wet working with kids, and I was with children and adolescents in treatment centers and psychiatric hospitals for a long time, and just trying to kind of find my way along those lines, but knew that I wanted to help others. And it was always a passion of mine to figure out how to do that. I had some relatives that struggled with addiction early on in my life, and so I was able to be exposed to that. I had an uncle that I really looked up to that owned a treatment center when I was a kid, and that gave me exposure to it. And then
that is interesting.
Yeah, and so I just kind of felt like I wanted to make a difference, and by having people in my life that suffered with addiction, people that I knew and close individuals to me that had mental health problems, I realized that it was something that there was so much stigma out there. And especially when I grew up, and in the 80s and 90s, there really wasn't much talk about it. There wasn't much education. There were all these anti-drug ads that were fueling things in the Nancy Reagan era. But there wasn't information, there wasn't empathy, there wasn't support. And I wanted to find a way to just be a human and help people learn to live better and learn to make their lives whole again. And I've gotten a lot of reward doing that over the years.
Yeah, no, and you do fantastic. And I know that, you shared that you've kind of gone on that diverse track of doing some administrative things in your career. And then I know that when, Blake and I had started Next Level, that you still were CEO of the telehealth, or you were owner of the telehealth, and you had this calling to do much more of like the private practice. So you do a lot of, of your own private practice, and you do a lot of work with the families or our actual clients. And it was something you were called back to do more of. What happened there?
Yeah, I mean, I think that that's always been the piece that I loved, being involved in providing services to patients and their families and being in the clinical model. And I never fully stepped away from it, even when I was the CEO of a facility, which, I ran for almost 6 years. I always wanted to be in the clinical. During that, I was running, supervisions and morning rounds, and I was helping with recommendations, and I was seeing some patients. But I started to, I guess, get burnt out by just being too much in the administrative side and not doing as much of what I love. So when I was fortunate to kind of break away from the treatment center that I was working with, I realized I need to really take this time and pause and go back 100% into clinical and private practice and doing what I love. And then I started missing the other side of it in terms of some of the administration and support in that role and the supervision and working with people that are new in the field and interns. And so then I realized, okay, let me go back to a group practice where I can work with students again, and I can work with younger therapists in the field and other therapists, and be able just to use my experience to hopefully make a difference from both ends of it. So
Yeah,
I split my time now, and I love doing both.
yeah, you definitely do. I mean, backstory is I worked for Dr. Jeffrey Huttman, who finally I called you Dr. Huttman for about a decade. Back in 2013, when my daughter was a baby, and she just finished elementary school. So I taught yoga and meditation, and then also did some outreach for Jeff back in the day. And we've always maintained and remained close, and you got to watch Blake and I develop and grow in the field, and we're a big piece of that by giving us our chance and kind of pushing us to do good things, and helped us steer away from some of the bad stuff that was going on at the time. And we're I know both of us are extremely grateful for you. And and you're a hands-on psychologist. When you run the program, you're hands-on. When you're with the family or with the client, you're very all in. And unfortunately, not all professionals, like I worked at many places after working with you, and I got to see the difference, and you're the real deal, and working with you on a weekly basis is just so refreshing for us. And having you be part of the intervention process with us, has made such a big difference. What do you think of, the intervention process that we do, and like your role in it? If you could explain maybe a little bit of what you do with us in that situation.
Well, sure. So first of all, just expanding on the background a little bit, running programs, working administratively in detoxes and inpatient facilities and residential. I had been on the other end of interventions for a long time, that the patient might be helped to get into a program from an interventionist. And so I got to see hands-on what interventions work and what interventions seem like someone that just, their whole goal is just to get them into treatment, but then the person is not motivated and not engaging. And so I really looked at it in terms of what is a successful intervention and what's not. So for me, getting involved at Next Level.
If you can go back just a step, what did you learn in that time and observe that, that is a difference maker for anyone that may be watching?
Yeah, I think a successful intervention is one that not only helps the family and helps the patient decide to go into treatment, but changes their level of insight and motivation before they even get there. So there are lots of interventions that I've seen where someone says, okay, fine, I'll go. And they just lament, and they get into treatment, and they spend a day or two just trying to leave treatment, and eventually do. That to me is, it's successful at the moment, but it's really not successful. Successful intervention is someone that comes in and they're really thinking about wow, I didn't realize that this was the impact I was having on my family. I didn't realize that this is what I was doing with my life. They get a change in insight from the dialogue and dynamic of the intervention, and they come in actually ready to get better and willing, not just having a foot in the door to convince the family they're going to do the right thing or get them off their back, but ready to make change. Those are the ones that go on and can be successful in a program. So I really valued that process. There were a lot of interventionists over the years that literally thought their hands were clean once they got the person to the door. And then you had to fight every day with your whole team on the inside just to block the person from leaving. It wasn't productive. It took the family's resources financially and emotionally. And when someone fails in treatment, unfortunately, the prognosis goes down a little bit every time, the next time that they might go into treatment. So a good intervention in someone that is ready to be involved and participate in treatment just makes their chances of success go exceptionally higher. And so it's all that. And then working with Next Level was the piece that I missed, being able to connect with families and with teams and with treatment teams, both before a patient comes into treatment, which is essential, and then, once they're in treatment and then afterwards. So I really like that. I realized that going back into private practice, doing telehealth and running a group practice, I still missed having my kind of foot involved with that inpatient world and residential world. And this kind of gave me the best of both. I can go to sleep at night. I'm not on call all the time, but I can still help in the process. And being able to, one of the things that I do is I get the luxury through Next Level in hearing about the background of an individual before the intervention, hearing all the legwork that's done to properly interview and assess the patients, the potential patients, the family members, all the thought that's put into finding the appropriate program and interviewing programs and talking about what's going to be the best piece, and then meeting with the family and hearing about what their worries are, helping them to understand the process and prepare them. That, I think, is invaluable because it helps prepare the person and the family for treatment, and it makes it much more likely to succeed.
Well, that's one thing I was thinking when you were saying what a successful intervention is. So sometimes we're going to get that person that is going to come in and is kind of ready through the process, but sometimes we're not. Sometimes the way that it comes once they're there. What role do you see the family playing in that? And if you want to touch on some of that, because sometimes we have to depend on the family to be the strong piece until the person can have that awakening.
Yeah. The family's role is essential. And, going back to running programs, I would be the person talking to the family members once the individual is in treatment, and the heartbreak and the emotions and the burnout and just how much it affected the family. You really understand what is meant when someone says this is a family disease, this is a family problem. And although the individual coming into treatment or getting intervened upon might be the person who's using and hurting themselves and the presenting problem, so to speak, it affects everybody. And the role of the family is essential, not only in understanding and providing support, but being willing to take a look at what's the family dynamic. For example, were we accidentally or unintentionally enabling? Were we not setting enough limits? Were we just letting them continue to use and harm themselves, and by not saying anything, is that prolonging the problem? There are many times when someone has not yet experienced profound consequences, like hospitalization psychiatrically, medical consequences, legal consequences, and the lack of consequences can prolong an addiction and do a lot of damage that is not recognized at the time.
Yes.
But the family sees it, and there's a consequence in the dynamic with the family because their loved one is essentially checked out, and they're seeing that, and being able to point that out to an individual and say, look, you are hurting yourself, and this is how we think you are, and how you're hurting us, and how you're missing out on life that is so valuable, and trying to make that connection. That is the first part. And then being willing to be supportive make changes if need be, tell the individual that, look, you're the one in treatment, but we're not done just because of that. Anything you want us to be involved in, we'll be there for. If there's a family weekend, if there's family therapy, what you need from a therapeutic standpoint will be there. But we're not just going to sit back from an external stance and allow you to hurt yourself while taking away risk factors, while maybe supporting you financially. And so I think that is a missing piece at first. And that's where the families need to come in and understand that I've rarely met too many individuals that go into treatment and are just psyched to be there, that say, oh, great, I've arrived. This is wonderful. This is what I dreamed of, my whole life.
Yes, this is what I wanted to be when I grew up. It's definitely not, I know the stigma out there of people thinking that a lot of this stuff is a choice. It's not a choice. Maybe there was choices at one point, but it gets far past that to where it's not what anyone wants,
Right. So no one says when I grow up, I want to be in treatment.
Right.
And so there shouldn't be an expectation that you're showing up at the Ritz-Carlton and that this is going to be easy and that you're going to be happy to be there. But if the family supports that while also understanding that it's vital for you to remain there, then the first phone call where you say, look, this place is terrible, it's dirty, you wouldn't believe it, I'm going to learn all this horrible stuff in treatment, come pick me up. They're not going to run there. They're going to help support the process and work with the treatment team. And getting over those initial days might make an enormous difference in saving someone's life. There's been so many individuals that I've worked with that hated it at first. And if the family didn't back up them being there, they would have left. And then they get better and they've maintained sobriety for, long term, for decades afterwards, and have a good life. I've seen that outcome. But it needs to start with everybody being on the same page and understanding that don't expect them to get into treatment and say, wow, everything's great. And even in the first few months or the first year, that's the reality. There's an illusion that everything just gets better. You get sober and you start to get stable, which allows for opportunities and advancement in your life. But then you've got to start working at what that's like and learn how to deal with emotions, the vulnerabilities, and the foundations of what built to this point in the first place. That might have taken years to get there. They're not going to go away overnight. But
again, the family piece, it's there's we talked about this on our podcast the other day. Is there's a lot of families that are before they start doing the work with us, right? Because it's a process when we do the next level intervention with you. We get all the information, we get family background, we learn if there's mental health and addiction that runs in the family, we learn if there's any traumas, we learn about so many different things. And there's so many families that are kind of want a professional or a professional team to kind of fix the situation. And it just doesn't work like that. We've learned along our journey, that kind of goes into what we've learned in the intervention process and why we utilize you. Because we were noticing that the family, yes, you can do the pre-intervention, the screenings, all those things, but if the time that they get with you pre and post intervention, like you said, they're there for 3 days. The family thinks that once their loved one goes away, everything's fine. And no, it's not. It's the beginning. It's great, So that's why we've added what we've added in with you, and it's so beneficial for families. How do you see it working, the pre and the post meetings? You meet with them a few days before the actual intervention, and then you meet with them a few days once their loved one's in care. And what do you see in those sessions?
So I agree. I think it's an invaluable piece to help prepare the family. There's such a range in what you see, but there's a lot of fear that the person might reject treatment, fear that the treatment center might not be able to handle their difficulties.
Yes.
Fear that they're going to lose their loved one, that they're not going to talk to them anymore, that they're going to get worse if they reject it.
Yeah, I'm getting.
And there's a lot of burnout and emotional distress, and it's easy to lose yourself in the substance abuse or mental health problem of your loved one and not be doing anything to care for yourself. And now is probably the most essential time to be able to engage in self-care, because if you keep yourself strong, then you're going to be able to participate. You're going to be less vulnerable to the emotional roller coaster that's potentially coming up. And so being able to do that. And then you see a lot of times that just opening up those questions about how's this affecting you and how are you caring for yourself? It makes it more accessible to the other family member that's sitting there thinking, oh, I didn't, I felt bad even bringing up myself, but I have the same concerns. And then they're able to dialogue with each other and support each other in a way that was unknown to them that they were even supposed to do, because the whole thought is about the individual who needs to get sober and who has the issues at the time that is leading to treatment in the first place. So
yeah. How often do you ask a family? Like, I know that when we Sarah and I were talking about this the other day, when we say, what do you, like, it's on the questionnaire, like, what do you do for your self-care? And some of them have been in this spiral for so long of just like crisis management and chaos and fear and like that, they stop doing it. They don't even have anything they do. They don't even know how to do that anymore. Like, do you see that often as well? Correct?
Very often. And they're not realizing, if it's significant enough and it's leading to their own anxiety or depression or something that might be more clinical in terms of symptomatology, then they also might be open to a therapist or open to some support. And, that happens a lot, that someone says, well, I don't need anything. And they start to realize they can feel much better with that piece if they need that. But a lot of times the self-care has gone by the wayside because they're living every day in fear that someone's going to hurt themselves or overdose or drop out of their lives. And then there's also a piece, especially if it's a parent and you're talking about the spouse who's involved, that is spending so much time taking care of their children also, that they're really burnt out and they've had to pick up the slack for the other individual. And just understanding that you really need some support and help, and to figure out what makes you tick, what causes you or will help you to relax and cope. And it doesn't just have to be about the other person. So I think that happens a lot. And a lot of times a light bulb will go off and they'll start talking about themselves for the first time, because so much of their energy has been spent talking about the absence of their partner or absence of their family member.
Absolutely. That it becomes so normal it just becomes normalized to them. Like, they almost don't know what to do. Can you, I kind of just briefly describe it. Could you talk a little bit about like what the pre and the post meetings like look like, and what, like you said, they're all different, going to be all different with each family dynamic, but what do you do in those meetings?
So the first thing I do, and this is just how I've always practiced, is I listen. I don't go in with a clear mission, because every family is different. Every individual who's struggling is different. And if I do that, I think that becomes part of the problem. Yeah. So I might ask a couple questions about what this is like for them. What are their concerns? Tell me a little bit about your loved one, and try to just get them a little bit talking, and so I can understand where they're coming from. I offer psychoeducation if they have questions, and I tell them that I'm open to answering any questions, and I try to get them talking with each other and figure out a way to model how they're supporting each other, and that could also branch into how they'll support their family member or friend once going into treatment. And there also are a lot of questions about what the treatment process is going to be like. And so I speak in general terms, because obviously I'm not working for the treatment center that the person might be going to, but I talk about what the stages of treatment. It's remarkable to me just how much of a lack of knowledge there is out there. Commercial.
It's our world, so we're used to it. But like, even Sarah said on the podcast the other day, IOP, I'm like, you have to explain what IOP is. Like, we talk in this terminology, but people don't understand these things in the real world, and they don't understand addiction, mental illness, like a lot of people out there. We're just so used to it.
So the illusion is often based on what they've seen on, dramatic television shows, what they see on scary commercials. There's not that much education. I mean, you can find the education now, luckily, going through YouTube or certain places if you educate yourself. But
quality, some not quality. That's what one of our.
And it could be misinformation, of course.
Yeah, we're putting out quality content today. Like, we're putting out good stuff.
Yeah. So I think there's a fear, there's a lack of education and knowledge. most people don't understand the difference in any level of care.
Yeah.
They only know if they happen to have someone who's in the family or friend that is a professional in the field.
Yes.
They might have listened to commercials, or they might have randomly called a treatment center, and it's hit or miss. You might get someone who's really open and natural that tells you the truth, and you might get someone who's marketing you that's going to get a bonus for getting into the program.
Right.
And so I see that a lot, and there's a lot of questions about what do the stages look like. Many people don't know that this is a process, that that this is not going to be necessarily put a cast on it, treat it for 4 to 6 weeks like a bone healing, and then they're going to be better.
Right.
And so starting to set that understanding, then I think there's always the worry it's going to create a fear that what are we getting into, that this is going to be long term. But I think it also sets a stage of understanding that this is a lifelong journey. Someone can live a great life in mental health and addiction stability through treatment and understanding how to help themselves and the right tools. But if you go in and the family goes in from the perspective, okay, well, we got 4 weeks to do this because that's what we paid for, and they're going to be better, they're likely to get a pretty significant surprise that it doesn't work like that, without understanding different levels of care, continuing care, the impact of 12-step meetings, if that's something that they're open to, the impact of medication management if necessary, the impact of ongoing therapy at lesser levels of care.
Yes.
So there's an entire process of understanding that, I feel like in the pre-intervention family work, I can help someone understand. And then I'm lucky to talk to the family afterwards. And if the intervention didn't go well, then there's a big support piece in helping them to feel okay about what they did and figure out how to continue to not give up and to stick with the individual and to be there for them when they are ready, and what they can continue to do to set limits so that when those consequences happen, which they ultimately will, if the addiction or mental health is bad enough, they know what to do then, and they're prepared for it this time. So none of the
boundaries are like how if someone doesn't go the day of, when the family stays strong, that's how they end up going within like a week, right? Like
Right.
because of the prep work and all those things, because it's very easy for families to fall back into the newly old behaviors. It's just so familiar, and you become very ill in that realm as a family member of someone in that spiral.
And if it's done right, then that is not a waste at all. If they don't go right away, so first of all, next level is great that they don't just say, okay, we're done. There's a follow-up that continues to go on to make education and support accessible. And I can help them to understand that, stick with it. It will happen. It doesn't always happen magically, but there is no wasted interventions. There is no wasted time in doing this, because now you're much better prepared. And I've seen many, many times where the person does come around. It takes them, maybe they're ready a week later, maybe they're ready a month or a year later. But addiction is a progressive illness. Mental health, it's untreated, is progressive. And unfortunately, we'll get there, and they'll need that help when they're ready to get it, and they'll get better from that. And then the other
thing too, Jeff, is when like people, when if the family is being open, so a lot of families are scared to confront the person, or scared to say anything. But even the ones that are saying something, like when it's like passerby, like we're worried, they don't hear it anymore. No one's hearing that. When you do this actual, thought out, planned out, research model of a family meeting, you can stop and pause that cycle, and they can actually hear something. So it gives an opportunity, and it's like a piece of magic sometimes.
Yeah.
I
couldn't agree more. They'll come in afterwards with a lot of fears that either the person got into treatment or they didn't, but there's still a lot of fears, and there's the unknown. And the reality is, while there are a lot of amazing programs that have great family support, the focus still in those initial days is on the individual going into treatment. And that's where most of the resources of treatment are geared towards. And so that is a time where the family member can sleep for the first time. They can recuperate, but they also have all these questions about what's happening now, what's going on with the treatment. And they need support as much as the individual who's in treatment to figure out what do we do next. And just being able to talk about it, get some psychoeducation on that, and have some of those questions answered, I think can be invaluable in preparing them and making themselves accessible for when the program is able to bring them in, and what they can do and how they can participate.
Yeah, I remember when we saw the need, like we, from a professional end, like to just obviously to support the families or the loved ones, whoever is involved in this, sometimes it's friends, like to support them before, during and after, because like we were noticing for us professionally that like we were getting blown up. The treatment center was getting blown up. But if they know they have a scheduled session with you, they have that. And it's so helpful for them, but also for all the teams and professionals involved.
Right. And there's a lot that is unsaid. So take the very basic concept of an adult going into treatment who voluntarily consents. They now are the privilege holder, which means that they don't have to release any information. They don't have to sign a release to let their family members even talk to the team. Yeah. And so if someone has a history of instability and addiction and mental health, they might be spinning, but say, I'm not going to sign a release. And they're creating this whirlwind in treatment around them. And then simultaneously, they might be calling their friend, their relative, their sibling, their spouse, their child even, and saying, you wouldn't believe what's happening here. I need to get out. This is horrible. I'm dying, whatever it is. And just by educating them to say, listen, did you tell them that you want to speak now? Do you want them to sign a release so that you can talk on their behalf with the clinical director, with the treatment provider, with the therapist, with the psychiatrist, and be brought in? Because their hands could be tied and they don't even know to say that. They might be getting 10 calls a day from the patient and yet not be able to talk with the team. And being brought into that loop can remedy everything in helping to set the stage and understanding that, really they're not being abused in treatment. They're actually being treated, and this is really what's going on. And so that's just one simple thing that happens, all the time.
Yeah, it's a big thing. And it's definitely like sometimes it's the only thing they feel like they can control. So they'll play that game with family because they're still not, just because they might be not using a substance that day, there's not a miracle that happens overnight. So sometimes it's a little bit of a process, but having a firm boundary too, that, if you're going to be calling me, that I need to be on releases, it's not fair. Like I love it when someone doesn't have a phone for a while and doesn't have access, because that just makes things so much better. Because I see people torment their families by getting their phones.
Absolutely. And some programs do that and other programs don't. So I think that that's an important thing to even understand ahead of time. And a lot of family members will say, I don't understand. Before I got the person into treatment, the program talked to me anytime I wanted. Anytime I called, I got an answer back. And now they went dark. And they don't understand, okay, either there's a blackout period for a week, or resources are put into the patient, or waiting for a release to be signed. Those things are not always tackled. And so helping the family to understand that there are some other things that can still be done.
Yes.
And help you to understand how to support the process and what that looks like. I once wrote in treatment center, I came up with something that I handed to patients and families, patients when they first started and family members at the same time, which was entitled 100 Ways to Blow Up Your Treatment. Because, you're raw at that time. You're trying to get better. You don't have your main coping skill, which might be your drug of choice. You're making yourself vulnerable. You're humble. You're entering a treatment world where it might be, if it's the first time, you have no idea who's around you and what the rules are, and all these people that don't know you are telling you what to do.
Right.
And everything becomes a source of aggravation for you.
Yes.
The TV's not big enough. There's dirt under my mattress. There's dirt under the bed. And the program could be perfect, but there's always going to be something wrong. And
absolutely. And there can always be something wrong that they could find. People, the staff, they're not like this. Then there's also never the right time to go, right? Because there's always an excuse to not go. Those are two things that I hear often,
Some patients are great and they have an optimal result, and they're perfectly aware and prepared for that. And I think those that have these family sessions that work with interventionists will have more of that preparation. But those are missing pieces to help educate the family, on, and I think it helps a lot.
Well, and that's another thing that we get to do as a team is get to support the family, with communicating with the treatment center, help the treatment center with communicating with the family and like having the same messaging of like, no, this is not what's like. So we get to be if everybody could have it for a loved one that goes in treatment, having the case management, having the intervention process, it just helps so much with the family, with the clinical team, everything. It makes it so wonderful.
Yeah.
To work together. Do you see the question, Jeff?
Yeah, I do. So this is a great question. How do you build trust and rapport with your clients, especially those who may be hesitant about therapy? So I think that's different for everybody.
Yeah.
At least my style is to try to always be respectful, listen, answer questions, be a human being.
Yeah.
Try to destigmatize the concept that therapy is only for the sickest individuals, but that therapy should be for everybody at some point in life. Try to destigmatize the embarrassment that goes into a lot of people feeling like I now need to seek therapy or I need to seek help, and redirecting it into the concept of this actually makes you strong. Someone who works on themselves, someone who wants to improve their lives, that to me is the biggest strength that you can have. To be willing to take a look at yourself and say, I'm not perfect and I need to make changes, and I'm willing to do that is powerful. I look at, especially with addiction, I work with a lot of individuals that say, I'm just embarrassed. I don't even know how to tell people that I'm sober now. And I say, there's nothing to be embarrassed about. It might be embarrassing when you're still using, but you're not saying I'm an addict. You're saying I'm in recovery. To me, that is something to be proud of. And that while there's stigma in people that don't understand addiction, they need to look at that as strength. How many people change anything about their lives or their bad habits? Someone who's going into recovery, and hopefully long-term recovery, every day is abstaining from something that had a complete hold on them at different times. Someone who has mental health problems that's willing to take a look at that and say, how do I improve myself? That's something to be respected. So I try to start from that. And again, it goes back to listening and, trying to help by asking enough questions to develop insight into how can therapy or how could treatment, how could this potentially help me? And how do I deal with this concept without thinking that it makes me weak, and knowing that it's actually going to make me stronger and hopefully a more well-rounded person.
And I can share from the next level point of view. So say we have a family and they're like not comfortable with therapy, or a client that isn't, they need it. We can start off with coaching, which is kind of just some education. Sometimes people are less threatened with coaching, and then, for the clinical, then move them into therapy. So sometimes just if a family member is like, I don't want to meet with the therapist, I don't need to, then we can say, okay, well, let's get you some education and some forward action steps with the coach, and then ease in the therapy if it's needed. But therapy, like I've been in therapy on and off since I was 7. I've been in therapy consistently again for about 4.5 years, pretty much weekly. When I travel, I don't, or when I have issues, or sometimes I go down to every other week. But for me, I've just had so much transition in my life. I think that a lot of people that aren't familiar with this, there is a stigma and a shame with it, but it's just not like that. And the more it's mental health is health. It's just like going to a doctor and taking care of yourself. It's health.
I agree. It's just good self-care. I also go over rules of confidentiality, make them understand that this is a safe place, that I'm not going to be judging you. And the reality is, if your friends and family could always help you, no one would benefit from therapy. Having someone who's not in your life in other ways, who's neutral, who's hopefully just doing it for you, not for themselves or anybody else, can really be an invaluable tool. And so I believe everybody should get therapy. And in my private practice, I work with those that might be very acute in their symptoms, to those that are that run billion-dollar enterprises, that are incredibly successful, or celebrity or athletes. and everybody has problems. It doesn't matter. So I think you need to understand that life is hard. There's a lot to live through. There's a lot of challenges that just go through being a human and living life, and talking to someone and being able to work through that and advance your methods for self-care and coping and just self-improvement, I think is essential. I was very lucky that, so the first time that I ever had experience of being on the other end of therapy was in my doctorate program. They required it. So every student, in order to graduate, had to do undergo at least 25 hours of their own therapy, which was, I thought, brilliant.
Absolutely love that.
A lot of programs don't do that, but they were smart enough to recognize that you're going to be in the field. You should make sure that you're healthy, and you also need to have empathy by being on the other side of this. And so it would help me work through things that I never thought were a problem. And it was just great in understanding that you don't have to be the most acute individual to better yourself. And
absolutely, we're big on that amongst our team too. If somebody, say we have a professional, a recovery associate on a long-term companion job, like they have access to have a session with Dr. Huttman, or with a therapist of their choice, or have coaching. Like, we believe in all of us taking care of ourselves as professionals, because we deal with a lot, and sometimes you don't take it home with you. Even like as a team, not long ago, we did a session with Dr. Huttman to kind of process like a lot of the stuff that we were going on and making sure we're implementing the proper boundaries and the proper self-care. Like, it's important for professionals to do it as well, and I know people in my personal life that are new to therapy and have like a shame and a thing around it. And I just want anyone who's out there that, any thoughts around that, there's no need to have that,
The healthiest providers and treatment centers are those that are open to that idea and do their own work. And I think that it is hypocritical if you're sitting there with your own work and you haven't ever taken a look at that, but you're telling other people what to do. Earlier in my career, I remember going into some programs as the clinical director, and you look around and you realize the staff are crying in the hallways. And they have their own difficulties because they're human, but nothing's being done. It's overlooked, and everybody is focusing on everybody else's problem. And a lot of times in this field, people go into it for that reason. They don't want to focus on themselves, so they focus on someone else. Best way to help someone else is if you're healthy, if you're able to go into work and feel good every day, if you're able to deal with what's going on in your personal life. And so I realized that very early on in treatment programs, where I would do workshops with the staff. I would bring in other people. You would make it accessible to talk about what happened with the patient care and how that impacted you, and how you might be taking that home with you, which is not healthy, and ways to avoid doing that and be able to talk and consult with each other. The consultation support from other staff is essential.
Absolutely. Yeah. And you do such great work with that. So I do have another question that we had talked about prior. So I'm sorry, I don't know why that's beeping. What the myth that someone needs to be ready. So what we see as breaking the cycle with the family meeting. So I still hear it all the time. And it's like an old saying, well, you can't help somebody until they're ready. What's the point of doing it? Like maybe one person will be ready for this intervention, and another person in the family is like, well, no, they're not ready. But we don't have that luxury, especially in today's world with fentanyl, to wait for people to be ready. Right. Yeah. So what do you think about that? Like that myth, and like, what do you have to say with your personal and professional experience with that?
Yeah. So, for starting the end backwards.
Yes.
When I first got into the addiction treatment world, we would say, 25, 30, more years ago, you're going to overdose. You're going to die if you go back out there. And the patients would call our bluff, and, maybe they would survive and it would be okay. And they thought of it as scare tactics. Now it is very real. There is an epidemic of fentanyl and synthetic drugs that are making drugs that people might have used for years potentially lethal on one time. And the rate of overdose and the rate of death and the rate of suicide, there is a reality you might not be able to wait and turn the clock back.
And it's in everything. So people think, oh, fentanyl was just in things like heroin, or it is like in everything now. It can be in a pill. It can be, I've even heard in marijuana that's being laced with it. I don't know how that's, but I mean, it's in anything. So nothing is safe.
And if the drug dealer's client survives, then they got a euphoric high that they loved and they go back for more. The problem is they don't know how it's being mixed, and you might be unlucky enough to get the pill where most of the fentanyl ends up in that pill, in that synthetic, and you do it once and you die. Or even smoking an oil that you think is THC and you don't know what it is. I mean, there's a lot of risks that never existed. But the original question is there a myth to you need to be ready? And to a certain extent there is. Look, I'm not going to lie. If the person is motivated and at a later stage of motivation and they're ready to actively participate and they want the help, they're going to hit the ground running, and that's going to be beneficial, and that's ideal for a family and the patient. But there are many times that they need a wake-up call, and it might be saving their lives. So I look at whatever gets them to treatment is potentially able to save their lives. I've worked with patients that have been in Florida. There's something called a Marchman Act, which is a civil commitment that forces someone into treatment for substances if it's likely to cause serious harm to them, and they might be ordered into treatment. They could be kicking and screaming for weeks and end up with a tremendously great result that they're stable and sober for the rest of their lives.
Yes.
There's people that have legal consequences that wouldn't have gone into treatment if they didn't have it. Those that are in treatment because their family says, we're not gonna let you keep being this way, or a spouse that says, I'm gonna leave you.
Yes.
If it gets you into treatment and opens your mind, and the treatment center is really good, then they'll move you along to a point where you can save your life and it can change everything. And just waiting sometimes for that miracle to happen where they're ready to go in on their time might be too long, unfortunately.
Yeah. There could be drinking and driving. There could be misuse of substances. There could be, poor decision making. There could be organs that fail.
Yeah.
So many things that sometimes you can't wait.
And I think family members tend to forget that they see their loved one there, whether it's an acute mental illness or addiction or both. They might see them and they're trying to talk to them and thinking they're going to get through. And when they're unstable or addicted, it's the substance that's talking, or it's their mental instability. They're not talking to someone that is going to logically listen to what they say and make sense of it. They might need that first few days of psychiatric stabilization or detox, even to start to wake up and be able to hear what's being said. So how do you even get there until you get them into treatment? If someone, so family members might be saying, you just need to stop drinking. You just need to stop using, opioids, and not understanding that there is a tolerance, there's a physical dependence, there's withdrawal. A lot of times it's just warding off the sickness symptoms that go along with withdrawal that keep someone using, not because they don't love their family or want to stop. And until they get into treatment and stop and start to get some mental clarity, there's no getting through to them, because the most important thing is not getting sick at that time. Yes. And finding their drug, unfortunately, even though maybe a year or 2 years or whatever before that, the most important thing was their family, you lose sight of that when you're totally dependent on something, or if you're in a manic episode because of mental health symptoms, or a psychotic episode. So, understanding that you can wait till they're motivated, but they might not be until a pause button is even hit to allow them to clear up and listen to the education, the support, and resources that are being provided.
Absolutely agree. Yeah, it's just, it's a tough thing, when you are a loved one and you watch somebody struggle. I've been on both sides of it. I've been the person struggling, and I found my aunt passed away in her bed, and I've had so much on all family, personal friends I've lost, It's a very hard thing to deal with, and it's very complex. And, we're here to answer any questions and walk anybody through it. If you have questions, definitely message us. But I do want to, we'll do this last question and then we'll kind of wrap it up. Do you want to read this question?
Yeah. Who's the question from? I don't want to mispronounce.
It's Usman. I believe, Usman, I would say, do you think social media is affecting mental health, particularly among younger populations where there are new or emerging mental health issues that you find particularly concerning or noteworthy? That's a fantastic question.
Yes, great question. And I know this is also popular now because didn't the Attorney General just come out with a statement saying that there should be a warning label on social media for youth
Yes.
and those type of things. I don't know. I'm not saying one way or the other what the warning would do, but I think the impacts of social media and figuring out a way to protect young people and educate them to it is vitally important. There's an algorithm obviously that picks up right away on social media where whatever you're looking at the most, it serves you more of that. So it's not an unbiased or balanced opinion of what someone is looking for when they're going down that rabbit hole of social media. You get on something and then on, your child or teenager could be on it for hours and they're only getting one side of the knowledge and it might be inaccurate information.
Yes.
So I think that's harmful. It also is taking them away from the realities of life. When I grew up, I would ride my bike, I'd play stickball on the streets in Philadelphia. You'd have some way of detaching from video games or and just being involved in the tech generation and children that are growing up with it. They don't get that balanced approach. So I think moderation is essential for everything, especially including social media and in education of what you're looking at and understanding that the news you're getting might not be the right news. If it's violence that you're looking at, that doesn't mean that everybody's violent. If it's sexually explicit content, that doesn't mean that everybody is looking at the world like that. And
Right.
so I think it's potentially damaging because it directs their mindset in one path without a parent or someone that's always there to give a counter argument to the approach and help with support and education. Does it always cause problems? I'm not saying that it does. Just like video games are not going to make every kid become a shooter, but the more that you expose your mind to things over and over and over again, the more it becomes natural in thinking this is how the world is.
Yeah, and I'd like to add that there is definitely among men, women, because I did a live with a trainer friend of mine about the male aspect, but the comparison of other people's lives too. That can, if you're not feeling good about yourself and you go look and you see someone, they're going to show you the best, few percent of their life on their social media. It's not real, and there's a lot of, or you see the
Yes.
is a vision of like a very flawless kind of body image. So it can definitely mess with people like that, especially young developing, you're in a very insecure place in your middle school, high school years of trying to figure out who you are in your body. So, and then COVID was a big thing that I think that people that were on the edge before, went over the edge. People that were healthy got very, so there's been a lot that has come up, but it has, in a positive light, shined a lot of light on it and removed some of the stigma for a lot of people.
Right. I think that's a great point. I mean, what's real and what's not. Not everybody's perfect. And if you're a teenager or adolescent, you feel like your life is on a stage and everybody's looking at you and you're vulnerable trying to come into your own. And if you're comparing yourself to someone on social media, it might not be attainable. And so who your mentor is and who's raising you can't be social media, because look at, it doesn't necessarily make someone a great person just because they have millions of followers and likes. It doesn't make you popular and a wonderful, ethical, moral person because you have more people that are liking your stuff. But you start to think that's the reward. And then it feeds the brain and it reinforces it. So there are lots of problems.
Mean on social media too. I mean, I've had some of them. I mean, and I read, when you say you look at it, like just a beautiful post about something, if you go read that comment section, so you have to be strong and healthy too. Like if you're going to put yourself out there, because it's toxic. It can be very toxic. It can be very beautiful. Like if you go look at my Instagram feed, it is full of beautiful things because I've chose that. You can choose your settings too and choose what you follow and what you don't follow.
It can destroy you. I've worked with, some celebrities that make the mistake of following along the comments, and they might be at the top of the world and have everything in their lives, but the impact emotionally on what that does to be cut down about what you look like, what you say all the time. And, just understanding that those are just opinions. It doesn't make you who you are, even if you're someone that no one would think of as being emotionally vulnerable because you're worth millions of dollars and you're a celebrity. So I've had a lot of individuals that just cut themselves. They might post things to have their opinion every once in a while or share it, but they don't even read the feedback because it's detrimental.
Yeah, no, over the years, even when I started being vocal about being, in recovery and being a trauma recovery, like on LinkedIn, like I got a lot of like really nasty comments. And so I had to, I've had to do my own work about some of the things because I put myself out there. So if I put myself out there, I'm going to get some of it back. So I think that's a great question. So we'll close with Sarah's question. Do you both have a favorite success story and all your years of work, intervention specific? I'll go first. I have two that come to my mind. There were two women years ago that were like kind of a few months apart that I intervened on, and both had to get Marchman acted, and they both hated me. I had to get them that court order to treatment after their intervention because they were threats to leave. One was just like going running down the street, and they were just kind of very much alike. I ended up introducing them, and they ended up becoming good friends. But they couldn't stand me. And then when they celebrated a year, they actually wanted to take me out and take me on a boat. And they've been in my life now consistently, and they've done amazing separately, and they're best friends. So they're a story that I love. And another one is not that long ago, we had one where it was the best intervention. It was almost like a crying love fest. We all went to lunch before flying to treatment. And then the client got there and something happened when they got to treatment where they went rogue. They hated us. It was this whole thing. We got to kind of participate at very minimal level. Releases were cut. And then we got a random email around Thanksgiving thanking us that they were still on track and apologizing and that they were just kind of going through things. So kind of seeing those very angry ones that are, have all these things to say and can't stand us, at a point, but then once they get better, they like come back and share that joy and that they're still, and we don't care about any of that stuff. None of that stuff matters. If you're doing good, that's like literally all I want. So those are just two stories that come into my head that are happy stories and make my heart full.
Yeah. I don't even know that I have a favorite. I mean, there's been a lot of years of practice. So, in a general sense, all my favorites are those that were able to find purpose in their life, go on, live a happy life with mental stability, being sober, being successful, being around their families. I've seen individuals that have been solitary and end up getting married and having good lives. So it's hard to think of one. I remember a 18-year-old that I worked with many years ago, and she told me that she was suicidal and that she was thinking about killing herself. And we talked for a while, and I told her about an experience with someone close to me that had committed suicide. And I just remember her doing a lot better than completing treatment. And she wrote me a letter about 5 years later out of nowhere, just thanking me that I saved her life with what we talked about that day. And, and I cried, and I still cry thinking about the impact that had, and that she remembered that. I didn't think about it, honestly, that much afterwards, but the fact that it had that type of meaning. And then quickly, another experience, I know we're out of time, that I had, which was really cool and meaningful, was I was running a treatment facility. And again, this was back probably in 2004 or 5. And there was a hurricane where the facility lost power for well over a week.
It was 2005 because Merrick was born. It was October of 2005 because I had no power with the newborn baby.
There were a bunch at that point of those type of storms in Florida. But so what we did was it went from like a residential program to all of a sudden groups are outside, and it was survival. Everybody had to have a function. We were grilling together. Everybody had a purpose, which was, you're in charge of the food or cleanup, or you're helping set up groups, or it became a true community. And, afterwards you realize there were patients that had schizophrenia. There were patients that had severe addictions that never left their apartment, that were not functioning at all. And all of a sudden, they did amazingly. They were doing great. And
That's
the difference was they had a purpose. And so that always resonated with me, that helping someone to understand that there's a reason to live, there's a purpose you can have, and you have value beyond what you can think of, could make a tremendous difference in life. And so that anecdote kind of stayed with me.
That's awesome. That's a really cool story. Well, people can find you, Dr. Huttman, on our website, nextlevelrecoveryassociates.com. Also, Dr. Huttman on Instagram, big Instagram guy. And then you can see, how else can people find you, Jeff?
I have a website, drhuttman.com. Easy enough.
Oh, that's easy. I love that.
Yeah.
I couldn't buy amandamarino.com. They've tried to hustle me for it and try to charge me some ridiculous amount.
Yeah, I'm all over. We have that. The other group that I run is called iRecovery, and it's iRecoveryUSA.com. That's all telehealth and an insurance-based program. And then for private practice stuff, it would just be my name, drhuttman.com.
Awesome.
Easy enough, and through Next Level.
Yeah, and then you can see my first episode of Intervention. Speaking of interventions, it's coming Monday at 8 p.m. on A&E Network. I believe you can see it on the app if you don't have it, or on Hulu. It streams, but not right away. So thank you for joining us today. Thank you so much, Jeff, for sharing your experience and the beautiful stories, and just for all that you do for the families that we work with, whether it's in the case management, companion side, or the intervention process. Like, it's just been a game changer having you involved in the work that you do. And
thank you for having me and allowing me to do the work that we do together. And I can't wait to see you on Intervention either.
Thanks so much. All right, everybody, have a great day. Message us if you were scared to comment or ask a question here. Thank you.
Bye-bye.